we're going to welcome up our panel, and I'm going to tell you who they are. We're not going to have a long panel because we chose to spend time to share with you all of those innovations that we have in the national capital area and how impressive they are. I do find it fascinating when we compare our area to others. Three things really stick out to me. It's our people, our data, and our opportunities. You know, our people, from our clinicians and scientists and technologists and planners, you name it, it's just a phenomenal brain trust that we have here in the national capital area. Our data, special thanks to our federal government colleagues, just awash in data to help us solve knotty problems. And then those opportunities that are created by that problem set and the funding that goes with them. It's just an amazing opportunity that we have here in the national capital area. So to talk about that, we have our panelists, and we can call you up one at a time. We can get your walk-in music. It's like baseball. It's like the Nats. First, Stephen Hubbard serves as a senior innovation architect and advisor to FDA's chief technology officer and director of innovation. For the past 3 years, Steve has been dedicated to building FDA's internal innovation ecosystem while leveraging emerging technologies and concepts to advance the scientific and regulatory mission of the FDA. Sanjay Koyani serves as acting executive director for innovation in HHS's immediate office of the secretary, providing leadership on HHS-wide innovation programs that enable HHS to improve healthcare outcomes and modernize government operations. Meagan Metzger is founder and CEO of Decode 42. At a break, you can ask Meagan what the name stands for. I thought that was pretty clever. You wouldn't guess it, by the way. It's really great. An IT graduate-level accelerator program that helps innovative, emerging technologies work with the federal government. And then Dr. Smith, Mark Smith, is a chief innovation officer of MedStar Health and the director of the MedStar Institute for Innovation, also called MI2, where he leads a system-wide initiative to catalyze innovation at MedStar Health. So thank you very much to our panelists. And by the way, thank you again for all of our speakers. I'd love to give you another round of applause. It's not only very difficult to do that in front of 300 of your closest friends, but just very cool stuff as well. And I'd love to kick it off as a segue from our previous session about what you all thought about that. Each of you run challenges and see kinds of pitches. What do you think about these and what they say about our national capital area? Anyone can go first.
All right, I'll jump in. I was extremely impressed with all the solutions here today. Those were absolutely fantastic, and I actually took a ton of notes because, obviously I'm going to come from the perspective of the federal government today, but there's tremendous amount of use cases that I saw even with the technologies that were presented. Some things that really jumped out to me, I was impressed with the, honing in on the specific use case, because I know that that's a big challenge when we work with a lot of the emerging tech, even some more established. But I particularly like the cybersecurity type of focus, talking about protecting the leakage of data, which we all know is huge. But I also, what popped to mind was there's now a trend, even in technology, to collect your blood sample and mail it off to a company that's going to tell you about your heritage. What? That's crazy to me. So there's going to be additional applications as technology continues to innovate in that way, where healthcare is becoming more accessible, or even kind of the situations like that. And I'll let some other folks jump in.
I think for me, looking at some of the use cases that people are attacking, and there's actually some of the things that we're looking at within FDA, particularly because these are some of the things that we do regulate. And so being able to look at the mixed reality and the virtual reality area on a personal level, some of the ones that really focus on caregiving and cancer, I'll share with the audience. I'm currently caring for a member of my family that is suffering and is dying from cancer, and being able to see some of the great innovations that folks are doing to help treat them. While you may not be able to treat my father-in-law today or tomorrow, there's hope for other individuals to be able to see it. So on a personal level, being able to see that is certainly an encouraging thought on my end.
Thanks, Steve. It does strike us very personally. Sanjay?
Terrific. Yeah. So I'll just add on what my colleagues mentioned. One thing that really struck a chord with me was the idea of data, and the fact that the federal government, HHS, has incredible amounts of data. Not much of it is open and in formats that I think would really help to benefit both folks like you and also what we're currently doing internally to really create a much more efficient and effective approach to how we do our work. So that was really fantastic. We're also, so I work in the Chief Technology Office, and we're trying to create a lot of these type of innovations because we typically put a lot of money out through grants and contracts, but we don't put enough through these really more innovative approaches. And so the more we get those out there, finding new approaches to old problems, we're starting to see some really creative things coming out, and we're trying to create a greater space for that kind of work. So it was cool to see these.
Any thoughts, Mark?
Sure. I thought it was great. It made me feel, once again, that it was a very optimistic view of the future, and that there is evidence for the truth that there is always a better way. And I was struck by a perfect storm of that's occurring now with the incredible increase in computational power. The fact that we've awakened a slumbering beast because healthcare is about 15 years behind other industries, and so there is only one way to go, and we can start moving fast. And that we're riding the trends, many of the presentations of care moving into the home, and all resulting in what I'd say, what actually was said by one of our speakers, a democratization of care, which I think is something to really watch for. And finally, I was struck by a comment made by the anatomy professor who said that we've been teaching human anatomy the same way for 100 years. And one of my sort of simple rules is that if you want to figure out where to innovate, look for something that hasn't changed in 40 years. It's either a perfect design, like the paper clip or the safety pin, or it is crying out for innovation.
That's awesome, Mark. Thank you very much. The paperclip. Sanjay, you just touched on something around open data, and obviously with the federal government being a next-door neighbor, the federal government is a purchaser of lots of innovation. And from an HHS perspective, your purview, you cut across Centers for Medicaid and Medicare and the innovations there, Food and Drug Administration collaborating with Steve, to Centers for Disease Control and the research at NIH, and you name it. Can you speak to the kind of innovations that you all are looking at or in need of now? You touched on open data, so I have a hunch that might be one of them.
Sure. Yeah. So the HHS we're looking for innovation, I would say, across the board. So we're looking at how we provide healthcare, we do public health surveillance, science and research, how we regulate the products we have. And so I wouldn't say it's necessarily any one area. I think it's across the board. I think what we're trying to do is to look at how we currently pay out for some of these different things, and then starting to create spaces for uses of prizes and challenges and crowdsourcing so we can get to different solutions. Typically, when we put out our money through contracts, grants, you pay for best service areas. When we put it out through prize and challenges, we're paying for the best ideas, and we're paying for these crowdsourced ideas. And in a lot of cases, we're then partnering with other groups with the private sector and others to try to accelerate solutions to those problems. So that to me is an area that's happening across all of our different segments. The other thing that we're really taking a hard look at, or two things I'll note, is our data, and how do we make that much more accessible, usable? What do we have in-house between administrative, our claims, and other data, and get it much more integrated and mashed up and accessible for not just ourselves, but also folks on the outside. And so we're going to start looking at how do we create front doors into that information, and how do we work with the private sector better to do that. We're also going to be looking at how do we just across the board, whether it's the venture capitalists or large tech companies, give much greater insight into where our priorities are, so that there's more of a joint collaboration around how do you fix those issues. And those are some interesting areas that we're heading in towards to try to solve this more collectively and more efficiently.
You mentioned a couple of the problems. Can you speak to a challenge or two that HHS has done? I know you all have done them, so I'm going to ask you guys
so
to
a great
pile on.
place to go if you want to see the range of challenges we have is on challenge.gov, which will give you not only what we're doing, but also across the federal government. I'll note one that we just kicked off with the Centers for Disease Control, where they're looking at surveillance and how we collect behavioral health data. And so the old traditional way is we collect information on determinants of health through phone calls, through interviews with the public, And a lot of that's expensive. A lot of that takes time to get. And now with the Internet of Things, with wearables, mobile phones, and social media, we're finding that a lot of that data can come in much faster through self-reporting in those mechanisms. So a prize and challenge has come off looking at what kind of models could be created collecting that data versus the previous format to really accelerate how we do this in a much more effective way. And again, the challenges we're doing really goes across the board, and challenge.gov is a great space to go to see where we're trying to create new approaches to old problems.
Excellent. And Mark, how about you on the idea of challenges? I did a little reading and saw a challenge you guys have at MedStar, thinking outside healthcare's traditional box, shifting the frame from patient to consumer. I'd love to hear more about that effort, as well as what works and what doesn't in these kinds of challenges.
Sure. So let me tell you the context of why we put that out, and then I'll tell you what it is. I personally stumbled upon this whole world of startup and entrepreneurship about 4 years ago when I visited 1776 down in D.C., one of the earliest incubators and accelerators in the region, and found that there are dozens and now even hundreds of companies that have great ideas. We saw 7 of them here, but what they don't have necessarily are is access to real life clinical care environments to test out and refine the validity of their concepts. And it's very hard if you're a big organization like we are, MedStar Health, $5 billion. What door do you knock on? How do you get in? And so it just happened that we became this MedStar Institute for Innovation, the de facto portal into the organization for lots of companies. And we've sort of advised, incubated, helped out dozens of companies that we think have great ideas, many through 7076, others through other portals. It's gotten so that we are having so many requests for access. We're up to probably about 500 in a year, that we decided, well, let's formalize it and let's see and put out a challenge that it's a level playing field. And we announced it just a month ago. We're holding entries closed for companies that are in this space of treating the person that we used to call the patient, more like consumers are treated in the other industries. We've gotten 75 applications, which is really pretty remarkable in just a month and a half. And on July 13th, down at 1776, we're going to have the 15 finalists make presentations, and then we're going to bring 3 to 5 of them into DC with 1776 and MedStar Health, and incubate them with our lending our subject matter expertise. I don't know how it's going to work. Like good innovation, you've got to try things and try them fast. And maybe next year I'll come back and report how effective this was.
Yeah, and press for Meagan, like how does that work? So you run those kinds of things and you incubate, and people have great ideas and come to you. How does that work in the incubator space?
Sure. So, I would say, Decode 42 is a little bit different. We've actually worked with several 1776 companies that have come through the program. So, we have a very specific focus on the federal government. For a lot of the reasons it sounds similar, where do you go? What door do you actually knock on in the federal space? Because every single agency is the size of a Fortune 100 company. HHS alone is massive with tons of potential opportunity. So one of the first things that we focus on when working with emerging tech is what use case are you actually solving and what problem are you solving? And it might be different, especially when you're looking at the government. So might be jumping ahead here, but when we work with a lot of technologies, we run our program based on themes. So we've done big data, advanced analytics. Right now we're running artificial intelligence and machine learning. And what I've found is there's a lot of technologies with tremendous applications into the health environment that aren't purpose-built for health in particular. So as an example, we're working with an artificial intelligence tool right now that can do image and voice recognition and do artificial intelligence and analytics on those calls. So imagine a soldier's in the field, places a call, and it can automatically run some intelligence to direct it to the right person to start getting the treatment that they need. We work with all stages. We work with some companies that have 5 to 10 people. We've worked with companies that have IPO'd, and they're all new to the government space, but the problem's all still the same. What problem are you solving? and then you can identify the right people, identify what messaging you need to actually go forward with for some real solutions. So orient around the problem.
No, I love it. And Stephen, I'm going to call on you here in a second, because what's coming out in that conversation is the idea of the ecosystem. Unless we think we're playing sort of bingo here with word terms, you can tell in the comments that there is an ecosystem. You have sort of strange bedfellows and competimates, as we like to say, that realize that you can't go it alone and that partnerships are really important. And Stephen, when we had previous chats, you had talked about some partnerships, and I wonder if you want to say a word or two about that.
So I think it's really important for us at FDA to have those partnerships, not only with our colleagues at the department level and across the federal space, but also with private industry, particularly because as an agency that regulates a lot of the drugs, the devices, the tobacco, we're still learning and we're still trying to evolve and keep up with some of the innovations that are happening in the private space. And it goes to a point where we don't just use the word innovation just as a buzzword. It actually means something to us. Like, we're trying to accomplish something that's new, something that's different, something that's going to help us get our jobs done as an agency faster, more efficiently, to better patient safety health. I think in particular, some of the aspects that some of my other colleagues have talked about, machine learning, supercomputing, these are all areas of challenges that we're sort of coming and evolving to. I think even the concept of next genomic sequencing, it was maybe 10 years ago, it took about $1 million to crunch a genome, and now, like you said, it'd be done about $1,000, I think is what the going number is. And for us at a time of being in an agency, it was cost prohibitive. Now we're able to do those things and be able to embrace those advantages and those technologies and these techniques. So by having those partnerships and being able to see how our partners in industry are doing it, how some of the other federal agencies are doing it, it really allows us to make innovation more than just a buzzword, but actual practice that we use in our agency.
Right? Any others on the topic of partnership?
I can jump in on that one, especially for technology, health IT that's looking at the federal government. He's spot on, because we still, we live in an era where partnerships are 90% of how you go to market, especially with the federal government. So finding the Booz Allens of the world, to give Rob a plug here as well, that we focus on what is that problem set you're solving and who has expertise in this field, so you can team up with them. And so they understand and know the inner workings of that agency, what problems they solve and how to go to market with them. You bring a very specific expertise in what you do that organization might not have, and together you can be very powerful.
So we've seen a shift in the last 5 years. When we first started as an innovation institute, we followed the lead of most innovation centers in healthcare systems, which were essentially to try to do tech transfer, monetize the intellectual property of the employees and associates of the organization. And we're not a high-power research institution or a high-power clinical institution. I'd like to think innovation institution. And we didn't have the kind of success with that I thought we might. But what we did discover was that the way forward for us was something we call collaborative commercialization, and trying to bring what we have to the table, which is patients and subject matter experts and lots of data, with companies, some startups, some big ones. Booz Allen, we have a collaborative relationship with them. They've got the data scientists, we have the data, and we're creating some wonderful things together. So that is, in my mind, the way forward, and we are always looking for partners who bring something to the table and who also share our values and who are nice people.
Was that an and or was it an or? Were they conjunctions of the? And we heard that this morning too in Dr. Shannon's remarks. There was one where he's talking about a particular partnership between UVA and Inova, and we've heard about collaborations with Virginia Tech. So it's one of the themes, I think, to the day. One of the things that we also offer, I posit, in the national capital area is this enormous talent and solution base in markets outside of health that are nonetheless applicable to health. In truth in advertising, I spent most of my career outside of health, and only recently have come into health with part of the raison d'etre to apply those things that we do in the defense market, in energy and transportation, in different kinds of arenas into health, partly because the lagging technology, partly because of a personal passion. And I'd like to think that, and knowing a bunch of you in the audience, you also hail from different markets. And I think to start the conversation, so Meagan, working with the federal government, you probably see lots of innovations, probably the lion's share, probably outside of health. But do you agree with that sort of assertion? And if so, are there examples that you could see of using things from other markets into this space?
Yeah, absolutely. And I would say it actually happens in bidirectional in that case. So we see a lot of technology that has applicability into health. So we've talked a lot today about predictive analytics, and there's applications in the government, outside of even HHS and FDA. So we think about DoD in particular. Can we use predictive analytics to better predict suicide rates for veterans? We can talk about virtual reality, which we saw some on today. Fantastic applications. If you look at, it's impossible to train a doctor. It's hard enough to learn how to do an operation correctly. It's another thing to do said operation in the field when you have, shrapnel flying your direction. So how can you use virtual reality to help train doctors to be better prepared for those environments? There's tremendous IoT applications that we've talked about, both into the health community. So is the doctor who he says he is when he walks into the room, or do we have an imposter that's going to steal some records? But then also things that you might not think about are CBP agents on the border. We don't think of America as having kind of these very hostile environments, but he's sitting in a bulletproof car on the top of a hill in the desert, hoping that he doesn't get shot at. What happens if he does? Can we use IoT? Can we use some better communication tools back into the field? And same type of principle when he's on a horse and he needs to take his glove off to call someone because he's having a medical emergency. DHS has actually done something interesting around monitoring the health of the dogs that walk around. And the dogs can't tell you when they're thirsty or about to keel over, but some IoT devices can. So there's a lot of applications, I think, in both directions. And it's just a really exciting time because this market is changing so quickly. So it's a great time to be in this space for sure.
Appreciate that, Meagan.
And quick plug, by the way, for
Please.
this region, because I can tell you when we look at, a lot of our companies are coming to us from the VC community. So as you can suspect, we get a lot of Silicon Valley, Chicago, Austin, Boston. When it comes to cyber and when it comes to health, all of our applications come from this area. And I was very excited to see a Springboard graduate in here as well, because that's a fantastic program. So this area in particular is very well suited for those capabilities.
Great. As others think about that, please chime in, but I can't help but think about a few things. We ran some competitions with Kaggle. Kaggle's a data science nonprofit, and we collaborated with Kaggle last couple of years with NHLBI on a heart health challenge, and then last year with the National Cancer Institute on a cancer challenge. And it's a challenge, but as we were also thinking about it and developing solutions around it, a lot of those solutions bore back to work with defense and security, trying to figure out if that scene and those fractals convey that there's an improvised explosive device in Afghanistan or Iraq. Those kinds of analytics and those types of digital solutions are the same types of solutions oftentimes that we talk about in this space. Or a conversation recently with a fellow from Google and a rep from SAMHSA, Substance Abuse Mental Health Administration, where if you type in, I think they fixed it, but if you type in, I'm thinking of committing suicide, I need help. Well, what would pop up is 10 ways to commit suicide and to do it painlessly as possible. Well, that's not so good. So back to the point before, I forgot which speaker said it, but talking about the technology making humans do human stuff better. These types of things can't be. So how do you inject humans and how do we mature our machine learning and artificial intelligence to a point where it doesn't give us those types of outputs and outcomes? These are things that we see in other sectors that we think we can apply to health. Other comments on that one about applying other spaces?
I just reemphasize the reason why I think HHS has picked up so many prize and challenge competitions and has done so much across each of its different sectors is because they realize that a lot of the great ideas aren't necessarily just coming from one domain. And so that may be cross domains in health, but also cross domains outside of the healthcare sector. And we work with specialized companies that help us to identify where those ideas might be coming from, match them up, almost like what you're doing with the data, is mashing them up to try to find some of the best solutions to problems that I think, as you said, Mark, they just haven't changed in a long time. And if you want to keep getting the same solutions to the same problems, keep funding the same old players through your grants and contract mechanisms, and you're probably not going to be speeding things up pretty quickly. But when you are getting those different crowdsourced ideas from unlikely partners, you are accelerating things much faster. And to your point, we are seeing a lot of the people applying for those prize and challenge competitions being from the regional area in a lot of cases, and bringing in a lot of that ideas and talents based on their knowledge of both government and what's happening in this area.
I think for us in particular, as our agency continues to grow and as we continue to have a lot of those reviewers or analysts who've been at the agency 20, 30 years, those are the generations that are getting ready to retire. And so being able to have these type of ideas to attract newer talent, younger talent, to be able to do things more efficiently, I think that's really the key for us, because now we're sort of having a good succession plan for our workforce, and we're able to continue to move things forward as far on the drug approval side, on the device approval side, so that we can do and solve some of these problems that we've talked about doing.
You know, we've mentioned some adjacent sectors, cybersecurity, which clearly are directly applicable in healthcare. There's one we haven't mentioned, which is the education and learning space. And there is a huge need to train and keep current. And so we have to find new and better ways of doing that. So that's one domain where I think we can borrow. And I guess the education space shares that distinction that I mentioned before with health, that it's about 15 years behind the development in other domains, and is rapidly changing too.
You know, in education, a different twist on education and learning, and we do have universities in the audience, both those that run hospital systems, but also the universities themselves doing research. Mark, you all have collaborated with universities. There's a program I saw is Health for America. It's an internship fellowship. Can you tell us some more about that? So you have challenges and grads that get into that. And has that been a good funnel of talent for you?
I tell you, most of the things that I look back on and say, you know, have been pretty successful. None of them were planned. And almost all of them started because of a personal connection, a one-to-one relationship, which I think is why these kind of meetings are great, because it is that liquid network that Stephen Johnson talks about, and where great ideas come from, book and TED Talk. But this was from a cardiologist from Hopkins, who then went to Google, and he and his wife started this program that was based on Teach for America. The idea was to take the kind of best and the brightest of kids coming out of college within 3 years of graduating, and assemble them into a healthcare system, go through a year-long curriculum in design thinking and entrepreneurship and health, and come up with an idea. And so they did it first at Christiana in Delaware, and then down at the Washington Hospital at MedStar with us, and then we actually gradually took over. The program is now Health for America at MedStar Health. Last year we did diabetes and came up with a program in nutritional literacy and food. And this year we're doing stroke, and have come up with a device that detects stroke when you're sleeping. But what's interesting, actually, to me, is that it's energizing to everyone in our organization who comes in contact with this next generation, and the great sense of optimism and possibilities for the future.
You know, on the optimism, and I do want to open it up in a sec to the audience, so if you have questions, just raise your hand and we'll get a mic to you. But to that next generation, I'd ask you, and particularly perhaps for our federal government colleagues, about our war for talent and how folks are passionate and what that means about what kind of jobs they're looking for. Because I know many of us in this room compete for some of the same talent, not only with each other, but with Silicon Valley and other places. Without giving away the family jewels or anything, are there certain things that you see as you're trying to recruit that talent? We talk about innovation until we're blue in the face, but innovations require innovators, people. So tell us a little bit about that.
I mean, I'll talk about it from the HHS perspective, and I think that we sometimes aren't the most competitive. So you look at what they're paying on the outside. You're looking at what kind of facilities and work-life arrangements that are happening, and I don't know if you look at the federal government, you're thinking, boy, that's the space where I'm going to really rock and roll. And so I think we recognize that. I think we've looked together, we've looked as an agency recently to say, how do we start enabling not only our current workforce to be better and more proficient at what we do, but then also how do we attract that talent so that we don't train people up on the policy side and immediately the private sector snags them with much better pay and much better facilities to then work for them as inside, knowledge around how the federal government operates. And so we've got a long way to go as to how we think culturally about how we're attracting that talent, what kind of incentives we can offer, and what's really going to keep them engaged in how the government does its work.
You're having that much of a challenge?
I imagine you are too.
Lay down the gauntlet.
I think for us in particular, we use our innovation program as sort of a selling point as our recruiting tool. It's very rare, and it happens to me all the time when I go to events and you say, oh, you work in the Office of Innovation there, really? And you work in the federal government? And it comes to a shock to people. So when we go out and we go on recruiting events, we go to colleges and universities in the areas, and we talk about our innovation program, and we're able to give them a virtual tour through some VR device or anything, it starts to get their minds to trigger and saying, well, hey, maybe this is something I want to be a part of. There are some people who really believe it's their civil duty to come work for the federal government and do good, but you have to have some sort of carrot, something to give them a thought to believe that they can come in and that we're not 10 years, 15 years behind in the technology and what we're doing. And so we definitely use our innovation program, and I often go and sit and such settings like these and talk about our programs to really get folks to be interested in coming to work, at least at FDA.
Great.
And I can add to this because since we work with these emerging tech firms that are offering massages and free food, it is hard to compete with that. Now, we've had some people on our board, actually, and we've actually worked with a lot of folks leaving government that want to go into tech, and kind of in the reverse. We get the question a lot. But what I found to be true is that those perks are fantastic, do not get me wrong. There's a very big hunger right now among the workforce to solve something real and to work on something that's meaningful. So no offense to Snapchat, but maybe they don't want to develop the next Snapchat anymore. They want to come and solve, find, the next, predict the next disease outbreak or work on something that has a lot of meaning. So I think there's tremendous opportunity right now for, everyone in this room, in the large organizations to attract this talent. The question is, how do you keep them? Because then they eventually will hit a point where they can wake up in the morning and ask Alexa what their traffic looks like, and then they get to work, they turn their computer on, go get a cup of coffee, talk to 10 people, and it's still not booted. So, I think it's a question of retention as well.
One thing I'll just add also to that is we created a program several years back called the Entrepreneurs in Residence Program, and the idea there was, how do you get people like you or others across the country who are experts in a certain area like big data analytics or through supply chain, and bring them into government for a 13-month rotation, sit on a major problem and try to solve it quickly and aggressively, and pair them up with some of these other experts in government to do that. Now, these folks typically take a cut in pay. We try to be as competitive as possible, but a lot of it's because it's solving a major health challenge or a human service side challenge in mental health to try to facilitate and fast track this. Most of the time, the folks that come in typically stay there for a couple of years because they're finding it to be so compelling to see what's happening as far as the funding side of government and what they're able to bring to the table. And a great example of this is over at our Health Resources and Services Administration. We used to have things like organ transplantation processes that were all paper-based, and you'd have to go through like 7 different handwritten labels just to get the process done. And so we were able to get somebody from UPS who's an expert in supply chain to come in and basically say, we know how to do this type of stuff, set up a pilot pretty quickly with a handheld scanner and a printer device, and completely digitize the process, piloted it with states, and within a couple of years had this working across the different states and is now a requirement. But again, the idea is government alone didn't really have the idea. Well, let's work with UPS, who's done this stuff in its sleep. And that individual wanted to come and work with government because they personally were touched by the issue and they wanted to help accelerate it. So some of it's just good marketing, but it's not just who we bring in government but also how we bring in some of the entrepreneurs to help us solve these problems that everybody wants to try to fix.
Yeah, I mentioned before about sharing our values, and the people who are attracted are people who want to make a difference, as Meagan said, not build the next photo app. And as you start looking back on your life, I'm in a stage of my life where I look back, and I must say I look back on it and I realize I am very fortunate that I did not spend my life trying to figure out ways of selling Marlboro cigarettes or Pepsi-Cola, but was in a health environment where I really could be ultimately helping people. But you also want to then have an environment that the person works in where they can feel like their talents are able to be expressed, and they're given the freedom to sort of follow their heart and their dream. And also the third thing is the you can't be an island. You have to if you have adjacent capabilities that will and resources that will help them. I think that becomes, you start creating a community, and it becomes very attractive, and actually people stay.
That's awesome. Where I thought, Sanjay, where I thought you were going with it for a second was 3D printing of organs. That's where I thought you were saying that's your next.
That's us.
That's you. Right, exactly. That's you guys. Sorry. Yeah. So let's open it up for questions. If you have a question, just raise your hand and we'll get a mic to you. While we're thinking about that, in terms of some of those innovations, I mentioned the 3D organ. What are some things that you see? You know, we call it the Wayback Machine. What about the Way Forward Machine? We saw some of these today, just some really neat presentations that are not forward, they're here now. And we heard about some of those in the morning. What are the really cool kind of things that you're seeing and hearing about? Anyone?
I can start. I think it's also helpful to think of innovation on a scale, if you will. What is innovation? So we've talked about robots, but we also have simple things like converting things from paper into digital format. And all of those are very critical to the entire health IT process, especially in government. So there's a lot of areas for disruption. I mean, we've seen, I've seen tools that are focused, now we have some AI push bots that can schedule patient, actually schedule a patient, update their medical records, and do all sorts of cool stuff without ever touching a human. So it's innovating very mundane processes and not an area you typically think of. And then, of course, we see the robots and new biometric ideas coming out. So I kind of encourage everyone to look at the entire spectrum, because there's a lot of areas and a lot of potential across the board.
I would say some of the main areas that nothing's going to be a surprise, I think, are this big data. How do we get our arms around our data and not just make it available? We collect a lot in government. We don't necessarily have it in a usable format and have it mashed up, so that if you're looking at determinants of health between the Health and Human Services, Department of Education, Department of Housing and Urban Development, all these things need to be tied up together to really start fixing some of these issues, and then figuring out what we have on the outside that needs to be married in with that. Also, how do we get our data out so that people can use it to spur innovation and create things with it that have value? We've got some great examples of that. We need to do a lot more of it. Machine learning, artificial intelligence, all this data needs to be poured into stuff that gets the unstructured data mapped much faster, so that we can make much better decisions and have greater analytic tools to do this kind of work. You're hearing a lot about the maker movement, the fact that people are hacking their own health. So you not just have people everybody's an entrepreneur now. And I think FDA is dealing with some challenges where people are creating their own solutions to problems and not waiting for the FDA to necessarily create that, or for others. And how does folks like CMS pay for these pieces that they normally wouldn't, but they are creating real fast value as this stuff gets democratized? I think the prize challenge competitions are great ways to move beyond our traditional mechanisms for how we fund and pay for these things. And we're starting to see really great dividends, and also how we take more agile approaches to contracts. So we're not just pushing things out as one big wholesale help us find a problem to a solution, but how do we actually do it in a more agile way, so we put something out and really understand user needs and your needs before we actually then provide the rest of the funds to really create solutions to problems. And so there's a number of others, but those really seem to be some hot stuff that's floating around government right now.
And I think for us, particularly in our laboratories, how we can able to get our mass spectrometers to be able to get those sensors out and get those data to our data platforms faster. We're doing more and more research within our agency, and so that IoT front is something that's certainly going to impact us, that we're already seeing now and we're going to be seeing in the future.
Yeah.
Well, I'd like to find the person who 11 years ago would be able to say how smartphone devices are going to transform everything we do in all of our lives. So I would suggest that we have no idea 10 years from now what is going to be, what the landscape is going to look like in terms of those things that are really frame shifting and change the way we think about and practice in this health space.
The last thing I was going to add is just one of the companies on their digital experience is matching up where the health IT field is and where the federal government is with expectations of the consumer, because now we, to your point, we have access to information anytime, anywhere, but we still have, quite a cumbersome process when it comes to many aspects of health. So some of the tools like the ones we saw today that are changing that, I think they're not only innovative, I think they're becoming necessary if we want to kind of garner the trust of citizens that are interacting with the systems that we provide. So the digital experience is, I think, another huge aspect of it.
Yeah. A few reactions. It's interesting. So, Sanjay, that point about how, especially with the federal government, you balance in your procurement approach, innovation with cost and lowest cost. There's probably about at least 24 folk in the audience who would probably want to collaborate with Bobby on a full day session to talk about how you do that. But what I think you also get challenges too, there's a question around blockchain before, and realizing that different folks, again, sort of competimates around this area, but all of us are in the health field, how we can take advantage and piggyback on technologies and innovations that we have. So I was chatting with Steve at lunch about a blockchain solution that we applied, sharing data between Brigham and Women's Hospital with the FDA. And that folks may not necessarily realize that. So we're asking, well, what about the blockchain? There are applications, and probably within your companies and your universities and your health plans and what have you, that you may not be aware of necessarily. Those kinds of things are out there. And again, the sort of competitiveness aside, there's the idea that we can kind of leapfrog and expedite this series of innovation. Again, any questions from the audience? The much coveted after lunch slot. Those cookies are settling in. And I realize, so we're going to have a break in a second, but how about then we conclude, unless there are questions, going once, with a statement. So again, part of this is that we are unique to this area, this national capital area. Final question for the entire group. What is unique about this area that Boston, Austin, Silicon Valley doesn't offer? And then when we're talking to candidates, whether they be students, they're looking for new employment, they're looking to apply their solution. What is it about this area, and Senator Kane touched on this a little bit as well, that should and would and does attract folks into it? Maybe if we start and just go down the horn. Steve, if you'd started off.
So I would say the challenges are real, the opportunities are rich, and that there's such a wealth of talent in this area. I've lived in this area pretty much my entire life, sans a few years, and being able to see how much this area has changed and has embraced technology, particularly in that Northern Virginia community, and how we've been able to interact and gain so much experience from it. I think this area, the sky is truly the limit as far as what we can do in this area as it relates to technology, and being able to live here and see it transform over the few years has definitely been something that I'm proud to say I've been a part of.
Sanjay?
I would say, the thing that immediately comes to me is the federal government. And HHS is the largest provider of healthcare. FDA is the largest regulator of medical products and consumer products. NIH is the largest biomedical research organization in the world. And so I think the one thing we're going to be taking a hard look at in our Chief Technology Office, we've got a new Chief Technology Officer who's joined our group from the private sector, is to look at how do we create greater value for folks like you and create a greater front door into what we have that where we could partner together to really have that shared incentive to drive things. And that includes things like the big data. What should we be prioritizing? What questions do we need to answer and push out? That includes some of our most pressing priorities that we need help in solving. And when we have talked with venture capitalists and other groups, they do think government's somewhat of a black box. They're not really sure what we have, what those priorities are, and if they make those investments, are they going to be sound investments, and what kind of data and other assets can we provide to do that? And the same thing with prize and challenge competitions, where HHS is one of the more robust prize challenge competition mechanisms, and we're looking for how do we accelerate that and make sure we're doing public-private partnerships to drive stuff that is going to be beneficial, again, co-beneficial for the work that we're doing. And so we're taking a hard look and a careful look at how we create those open discussions. We make it easier for that front door to be open, for us to have those dialogues, and then for us to figure out what can we do to accelerate that kind of connection and partnerships to create the value. And so when you look at just the size and the spending of Health and Human Services, there's a great opportunity. We just need to do a lot more of this stuff in partnership with the public and with folks like you.
Thanks, Sanjay. Meagan?
Yeah, so a lot of what I'm going to say will echo what Sanjay is saying, but we work with technologies across the country, and they come here for a reason. So they're interested in not just the federal government, but there's incredible healthcare systems around here, a fantastic education system. So we kind of sit at not just the center as nation's capital, but where a lot of fantastic talent and opportunity collides together. And with that, working with organizations like the federal government, not without its challenges and not necessarily easy. So we don't want to sugarcoat it, but there is tremendous opportunity to really affect the entire world and the nation itself. Because if you can work with the government, the size of contracts, even that they consider small, $1 million to a healthcare startup could really change their entire company. And now they're viable, and now they can go out and take that technology into the world at a much larger scale. So it can help companies scale. It can help provide the funding that's needed to really get over that hurdle. If, on the flip side, we can work with government, like these two gentlemen here, to overcome their risk aversion to doing those types of things.
Our startups in the audience said yes, please. Mark, you take it.
Yeah, I'll just file. I would say, I'd say we're not for everybody. It's for people who sort of like being where the action is, like being where inside the beltway is not pejorative. At the same time, we're green. We're livable. We're at a scale that's human. We've got incredible diversity of people living here, and all the cultural accoutrements that come with that, restaurants, museums, theater. I mean, this is an incredibly wonderful place to live and very attractive. But you got to like being where the action is, and it definitely is in Washington, D.C.
With some about traffic. Never mind about the traffic. Please join me in thanking our panelists.